USDA 2014 Report Back webinar. I know some of you have attended USDA in the past and have attended this year. And so today we just wanted to give you a few of the important takebacks that one of our brown bag lunch leaders put together. Her name is Linda Stringfellow, and she is the community co-chair for BTAN Mississippi. And she won a scholarship to attend USDA this year based on her performance as a brown bag lunch leader. And I'll let her kind of introduce herself a little bit later, but we're very proud of her work that she's done this year in this program. So congratulations to her. So just to give you a few objectives for today's webinar, we're going to do an overview of USDA, and then Linda's going to go into these 4 updates that she thought were important takeaways from the conference this year. So community mobilization, HIV is not a crime, so really going into criminalization, care coordination and patient navigation, and then BTAN and brown bag lunch. And we're going to have some question and answers, and then we'll go into some Black AIDS Institute announcements. So for those of you who are not familiar with USDA, it is an annual conference held by the National Minority AIDS Council, and it's usually held at the end of the 3rd quarter of every year. It's the largest AIDS-related gathering in the United States, and the goal is to really increase the strength and diversity of the community-based response to HIV and AIDS. And it consists of 3 to 5 days of seminars, workshops, roundtables, and poster presentations, and of course, not mentioned on here, but really interesting plenary discussions, and we'll talk a little bit about those later. And you know, as most conferences do, USDA serves as an opportunity to network and establish partnerships in your state and really across the country as well. So this year, USDA was in San Diego, and this is a picture that I took. Kudos to me. That's the hotel, that's the host hotel for the conference, and so we were right on the water. It was really pretty. But really, the focus of USDA this year, and why it was held in San Diego, was really want to look at the effect of HIV and AIDS on the Latino community. And so our first opening plenary was focused on the Latino impact of HIV/AIDS on the Latino community and what's going on in various organizations to kind of address the disproportionate effect on Latinos. And so the following pictures that I'm going to show you were taken by our BTAN Bay Area co-chair, Jesse Brooks. And so I just wanted to give him credit for these next pictures. This picture is of our BTAN folks from across the country. This is kind of a smaller group than we actually have, but you see a lot of Black AIDS Institute staff here, and you see some BTAN members and co-chairs from across the country. And in this picture, we have some folks from Florida, Louisiana, California, and Atlanta, and Chicago represented here. And so this picture is from the opening plenary. And the theme of this year's conference was transforming together. And so the most important, I think one of the most important ideas that I left with was we have to remember that we can't leave anybody behind in the fight against HIV/AIDS. So we have to, transform this epidemic together. And so generally throughout the conference, you see conversations about Latinos, you see conversations about African Americans, elderly people with HIV and who are at risk for HIV, long-term survivors, and of course, remembering to not leave behind transgender men and women who are infected or who are at high risk of HIV. And so that's a common theme that you see throughout the conference. One of the plenaries, we had Laverne Cox speak, and everybody was really excited to see her. She talked a lot about how transgender women especially are being left behind in research, surveillance research, in clinical trials, in prevention research, all these kinds of things. And so really kind of revamping how we do research and how we do surveillance for HIV, and making sure that people who are at highest risk, such as transgender women, are included in those numbers as well, so we can really end this epidemic. And so this was at the end of Laverne's talk, and it's kind of a celebration of there were a lot of trans women who were who are part of this plenary, and so they had a couple of dances, they had some trans women speak, and it was really exciting to see them just kind of having fun and celebrating their womanhood. And so this was from the MERC plenary, and these three individuals were from the MERC's iDesign team, and so what their focus is kind of getting vocal about treatment. And so each of them have, there's three amazing stories, and I hope that at some point you can kind of go and watch the plenary. I'll try to find videos if they're available to send out to you all, because they're really, really powerful. So really what iDesign is to really kind of be open and vocal about what treatment plans people are taking, so that people can stay adherent to their medications. So this kind of gives you like a breakdown of what each day was kind of the main focus of each day, including the plenaries that I just talked about. And the last day, as you see here on the bottom, was talking about incorporating viral hepatitis into HIV efforts, because as we know, there's a lot of overlap between the two, between hepatitis C specifically and HIV, and so that was the focus of the last day, but I didn't have a picture for that. And so now that I've given you all kind of like an introduction or an overview of what USCA looked like, I'm going to turn it over to Linda, and I'll let her introduce herself. But what she's going to do is kind of go into 4 different sessions that she thought were really key sessions for the work that we do in Brown Bag Lunch Program, in BTAN, and here at the Black AIDS Institute. And so, Linda?
Good morning and good lunchtime, everyone. I'm Linda Stringfellow, and I'm happy to say I appreciate and value the opportunity to attend USCA as the BBL winner for this year. I serve in several capacities. I'm the community co-chair for BTAN, Mississippi, alongside Cedric Sturdivant. I'm also the community co-chair for Mississippi HIV Planning Group with the State Department of Health. But my actual job is I'm the director of the National Service Program, AmeriCorps VISTA, at Delta State University. I wear several hats, but my heart and passion is with HIV and AIDS awareness and advocacy work. Okay, next slide. The first session that I attended was on community mobilization. The actual name of the workshop was Community Mobilization Initiative to Expand HIV Testing and Lymphatic Care in Non-Clinical Settings for African American and Latino populations. I summarized the workshop according to the 5 phases to mobilize the community. I give you general information and then go into more detail about some of the actual events that the agencies had and discussed in the workshop. When it comes to, well, first of all, the CDC identifies community mobilization as engaging all sectors of the population in a community-wide effort to address health, social, and environmental issues. With the 5 stages of mobilizing the community, when we talked about planning, or when the presenters talked about planning, they all planned at least a year before their event. They looked at what is the need that that has been identified that they should meet, making sure they had the right people involved, who would take the lead, whether that was a particular person or organization, and they began with the end in mind. What is their overall goal? Whether that was a number, whether that it was to accomplish a task by a particular time, what are the strategies that they need to take, and how would they measure progress, and pretty much what is the money needed and where would that money come from to support the initiative. During the awareness part, they worked with the media. They looked at who needs to be involved, what are the themes, what are some of the logos they need to use, making sure that they relayed the right message to the right population, and that's the population that was identified where there was a problem identified. And how would that initiative make an impact on the problem or the need identified. In the building a coalition, they looked at the partners. Do a particular type of agreement need to be established between those partners? What is the unified vision? Bring them on board as a part of the planning team. Who should sit at the table to make sure that this event takes place and is successful? What are some of the things they're able to provide, as well as funding, resources, that's human resources and material resources. And those partners can also help connect them to other partners. And the biggest thing they talked about was go outside of, I would say, the grid. Don't just focus on health organizations, because we know that HIV is a health disparity. Go with agencies that are outside of health focus. And that helps build a stronger partnership, and that makes a more successful event, and that brings in a different level of resources. The taking action. What is the event schedule? When is the event schedule? Where should it be held? What is what's the project timeline? Who's responsible for what, and at what capacity? Volunteers, volunteers, volunteers are key, because staff with the agencies, all agencies that are partnering and coming together collectively to make the event successful, the staff is limited, and volunteers are key, as well as that adds a big value, showing support from other organizations and the community of the event. Excuse me, and the evaluation part, measuring success, and at what period did they measure success. So there were 3 projects that were talked about during this workshop. New York City had an initiative called Take the Train, Take the Test. It was for anyone interested in being tested. They had navigators on the train with materials, and these navigators were very important because they spoke English and Spanish. This same type of initiative, or similar initiative, was also duplicated in Boston, and let me repeat that. I'm not sure which one did it first. I can't remember, New York City or Boston, but both did Take the Train, Take the Test. And the key populations were age 14 to 29. In Oakland, they went a different type of initiative, and that was Test for Tickets. Their target populations were 14 to 24-year-olds, and one of the key things that will be of an interest to that population, 14 to 24-year-olds, of course, is hip-hop. So they test for tickets, and the individuals were tested, and they received a ticket to a hip-hop concert, and E40 performed, and Adrian Marcel performed. All of the presenters mentioned that they had a volunteer coordinator, which was key, and one of the volunteer coordinators, I can't remember from what city, was in the room at the workshop, and it was because they continued to mention that volunteers were vital, and they had to have a coordinator that specifically outlined the roles and responsibilities of the volunteers at each of the events. Want to add anything, Rebecca?
No, just that the volunteer coordinator was from Take the Test Boston, who was actually in the room.
Thank you. Okay, next slide. Okay, community mobilization takeaways. The things that as I was attending each session, I thought about my role with HPG and my role with BTAN, and even some of the roles that I have with my actual organization. And so as I present these, it's from that perspective. So work with me. The first thing is expand the base of community support from HIV awareness and how BTAN can be involved. One of the biggest things we want to work with in Mississippi pertaining to BTAN and within a BDL is how can we be involved in community mobilization, because we have a closer connect with the community, especially grassroots communities, because we have a lot of rural areas in the state. We know we work with CBOs, which is community-based organizations, AIDS-served organizations, building a better network with health departments, and look at how we all could come together to do more and work with the community more and use some of the concepts and even these initiatives. In some of our areas of the state, we don't have trains, but we do have public bus transportation. So instead of take the train, it may be take the bus, take the test. We will also look at collaborating to have a venue for take the test, test for a ticket rather. So we look at our areas across the state that can probably take a project that was discussed in the workshop and expand it. And then for some of our rural areas, we also look at what are nice, how would you say, snappy, eye-catching initiatives that we could have in rural parts of the state, and all of these entities can collaborate. So we know it will adjust according to the area of the state, whether it's rural, metro, urban, and then we'll develop from there, and we want VTAN to be a part of that coaching and that collaboration process. This is also an opportunity for us to recruit and bring new VTAN members to the chapter. And Rebecca will talk to you more about VTAN. And VTAN, we want VTAN Mississippi to reflect all populations across the state of Mississippi that are affected and infected by HIV. We also want to increase cross-sector collaboration and strengthen resources. Once again, as they talked about in the presentation, go outside of the box. Go outside of the normal realm. It's a health issue, but we don't just want to work and collaborate with health departments, health organizations. If we need concert tickets, we want to be able to have a free space, let's say with the Civic Center in a city, or we want to be able to have free space at a convention center. So we want partners of that nature on board, and of course the Chamber of Commerce. And if we need T-shirts for our volunteers, we want to be able to bring on board the actual company or the store or business that makes the T-shirts locally. Those are just general ideas. Next presentation. Next slide. Criminalization. This time I'm not going to read the name of the workshop. It's at the top. But criminalization is a hot topic at this point. It was fortunate to be in the room with presenters that were actually from Iowa that had just completed the changes and it had gone through the vote process and was changed or overturned the law in Iowa, and it was Iowa Code 709C, the criminal transmission of HIV. So our presenters were hands-on from the beginning with reviewing the laws, as well as being a part of the advocacy process, meeting with legislatures, assisting in the writing, and getting it pushed through to the very end for the changes to be put into effect. So that was key because they were there from beginning to, if not the end, the current level in the state of Iowa. One of the things that they talked about with us was make sure you know the law for your state because the laws are different. And one of the key things was 34 states and 2 territories have laws that criminalize exposing a person to and or transmitting a contagious disease. 30 states have statutes that specifically mention HIV. Make sure you know if your state mentions HIV or not. Iowa ranks second in prosecution behind Tennessee of persons with HIV, despite having a relatively small number of persons living with HIV/AIDS. They also expressed that we should not only familiarize yourself with the law, know the aims of the law, and is it advancing their goals? And when it says their goals, we're talking about the lawmakers. Is it advancing their goals? 3 things to consider. Should look at improving alignment with constructive public health approach. Should also look at assure consistency in controls and penalties across contagious diseases. And the third is consider costs associated with prosecutions and incarcerations that may impact other state and local governmental bodies. One of the things that they highlighted consistently was a lot of the laws are aimed at HIV-positive people. And as we're looking at laws and talking with legislatures or lawmakers and policymakers, we should also look at, we should educate and not influence. And when they're talking about education, a lot of legislators or policymakers and even law enforcement are not familiar with the basics when it comes to HIV/AIDS. We should focus on education. Also, health department cannot advocate, but health department should be a key partner when you talk about educating these particular populations, and when I'm saying law enforcement as well as legislature and policymakers. If they're presented with the facts, that will help remove the fear, because as we all discussed in the room, a lot of the laws or things being put in place is more out of fear of not knowing or not knowing the facts. So we should present the facts. And anytime there's an education opportunity, the facts should be presented. And that will help remove some of the fear. A key thing that stuck out with me was know your funnel date. And what is meant by the funnel date, it's your judiciary chair. There are particular dates where, there are the final dates that bills can be reported out of committee. I'm not an expert on how this works, but I will encourage everyone, do more research about funnel dates, and those are the dates through the judiciary chair and when a bill can be reported out of committee. Because if those dates are missed at each point in this stage of creating a law or changing a law or code, if it's missed, it will not be able to be picked back up until that time next year. It's very important to know these dates. And at the current time, with the number of states and the level, or rather the terminology that is used in a lot of the codes and laws in the state, a lot of them are doing more harm than good, and a lot of them are contrary to public health goals. They raise issues, raise due process issues, and they also encourage non-disclosure. The biggest thing is always keep in mind it's public health, and that's where we begin when it's starting being discussed with legislatures, elected or appointed officials. It's a public health matter, and that is the base, and that they encourage us. That is what we should stick with. Next slide. Okay, takeaways. Of course, begin at the beginning. Research your state law. Get a copy, make sure you go through it to get a better understanding of it. Especially the terminology. One of the things that we would do is, in our upcoming B10 meetings for 2015, we will educate others. That will be one of the training topics, criminalization and what the actual law is for the state of Mississippi, and who it affects, and what are some of the things that need to look at, being reviewed, changed, and who should be involved. Share this also with the HIV planning group for the state and the Ryan White team. Our state is in the middle of merging, become one body, and so by April 2015, we will be one body. But either way, we want to make sure we start sharing this material now so that these individuals from all the population, the community, CBOs, ASOs, health department, and other partners like the Department of Education, Department of Correction, all of them have representation on these bodies, and we all can sit down and have a discussion to get a better idea to see what should be done for the state of Mississippi. We are collaborating with the Mississippi Center for Justice. We have a group of law student interns that will be coming to the state in early spring 2015 to do actual case studies, and it is a service learning opportunity for those law school students, and it's specifically about criminalization and HIV laws in the state of Mississippi. So we are very excited about this opportunity, and this material will be shared with them prior to them coming to the state in spring 2015. Once again, educate, educate, educate elected, appointed officials and law enforcement. The reason why law enforcement is added because in our state now we have a matter on the book where an individual that is HIV positive spit on a police officer, and that individual is looking at 25 years. So we not only need to educate the people that make the laws, we got to educate our law enforcement and correctional officers because they need to know the basics. And we're looking to the health department and funded CBOs through the health department and CDC to do the education component. Share the 15 ways. I will not read all 15, but we have a sheet that was handed to us in the workshop, and it talks about the 15 ways HIV criminalization law harm us all. And I named 2 or 3, but one of the ones that stuck out to me was number 6, which is unjust prosecution. Intent to transmit is not required to prosecute. That stuck out with me, and it's extremely difficult to provide disclosure. But Rebecca has a copy of the 15, and if you would like a copy of those, email her and she will be happy to send them to you. Always remember, our approach is public health, public health, public health. That's where it stems from, and that's the direction we should build from pertaining to criminalization. Next slide.
Okay, before we move on, I just wanted to say if any of you are interested in finding out the your state's laws on HIV criminalization, there's a website, hivlawandpolicy.org, and then you can click on your state and they give you the exact statutes that include HIV or any type of transmission infectious disease. I've got to put the link also in the chat box, so you can also look at that there. And I forgot to mention earlier, if you have a question about any of the content that you're hearing, please use the chat function, and then we'll address those questions at the end of the webinar.
Thank you, Rebecca. Okay, care coordination and patient navigation. The first thing I want to highlight is this was a train-the-trainer session, and that immediately stuck out with me because I'm a stickler for finding curriculums and being able to bring the actual curriculum back so that other staff and agencies can go through the curriculums and train their staff. So that's why I immediately jumped on this one when I saw it. The care coordination fundamental curriculum, there are 24 sessions, and each session is 2 hours, and one session builds on the other. It introduces CBOs, ASO staff to the concepts of patient navigation and care coordination. So, excuse me. In the care coordination component, or the purpose of care coordination, is to reduce fragmentation of care, patients access timely and appropriate care, engage more fully in their own care, and it should involve the patient, their family, the provider, and knowledge of the system. The easiest way that I could process this information, or the curriculum, was the care coordination. It is, we start you through the process, we help you make your schedules, and we connect you to scheduling appointments, scheduling care, and making sure that it's the correct care. And we provide that information also to family members if that's who you agree we should provide the information to, as well as what particular providers, whether that's an ASO or a CPO, the ones that we are connected to and we have resources from, and the system that we haven't followed. I'm noticing, or as the presenters were discussing, there's a transition taking place. We're seeing patient navigation more. We're seeing that terminology more. And so it's been a transition from care coordination to patient navigation. And with the patient navigation, it's a holistic approach. We don't just start you. We identify and reduce barriers. We identify barriers. We talk with you and help you identify barriers. And then once we've identified, talked, we're aware of them, and now we sit down and connect you to resources, not just pertaining to barriers, just for you to have better services. And then we go from that step is, I say, sustainability, and I do apologize because that's an organizational terminology, but as a person, it's how do we help the patient understand? How do we help you stay into care? How do we help you meet your appointments consistently? Make sure that you take your meds. Make sure you're aware of your meds, new medications. So it's the holistic approach. We're getting you in, working with you, as well as teaching you to maintain and manage after we've gotten you started on the process. Once again, like I said, this was a trainer. There is a curriculum. So if anyone wants a curriculum, you can email Rebecca, and she'll be happy to provide you a copy of the actual curriculum. Next slide. Okay, takeaways. Of course, I want to share this manual with, of course, the other B10 co-chair and anyone else that does this type of work and is ready for that transition from patient coordination to patient navigation. Anyone that is interested, that is the first takeaway. I want to share this manual with anyone that is interested and will use it. The next one is educate patient navigation committee. With B10, every B10 chapter has a patient navigation team. So one of the things that I would love to see is the patient navigation team has this manual and they train themselves on this manual. That way that will strengthen the patient navigation component of B10, our B10 chapter and any B10 chapter. Of course, like I said, share with health departments, CBOs, ASOs, all the staff there. Encourage health departments to coordinate a training for their staff. There was one particular class that stuck out for me, and this is nothing against the health department, but it's a part of a barrier that in the state of Mississippi a lot of individuals discussed with us. And it was session number 23, professional boundaries. One of the biggest obstacles that we have in the state is beneficiaries, or not beneficiaries, clients, recipients of services, trust in the health department. So our CBOs, I'm happy to say our CBOs and ASOs are more successful with reaching individuals because they're not employees of the health department. So that's why I made that statement about the professional boundary session. We're encouraging our health departments to coordinate a training specifically for their staff, and not just that topic, several other topics. And the other one is utilize the Regional Resource Network program. Is anyone familiar with the Regional Resource Network program? Okay, I don't see any hands. Okay, the Regional Resource Network program, and Rebecca also has information on this. It is it's a part of the Department of Health and Human Services, and they work with communities across the country in helping and bringing coordinated national response to the HIV epidemic. They follow in-house the National HIV and AIDS Strategy and the action steps mentioned in the National HIV and AIDS Strategy. There are 10 regional resource consultants, and we do have the name, address, and contact information for those 10 consultants. One of the things that I did understand pertaining to the RRNP is it's about consistency in the information that's provided, consistency in connecting CBOs and individuals to resources, and consistency in reporting, which is good. The same information is given out, the same networks are being provided to individuals, and agencies and individuals are working to be on the same track according to what was requested by in-house and the action steps in in-house. Next slide.
Okay, so here's where I take over. So I wanted to talk to you all a little bit about our BTAN national meeting, which took place the day before the conference actually started. And I want to kind of give you a background of what we talked about in the BTAN national meeting, because Linda will then go into how Brown Bag Lunch and BTAN are a great collaboration. And so for those of you who are not familiar with BTAN, it's a national network of highly trained treatment advocates who are poised to address the epidemic at the local level. And so even though it's a national network, we have these chapters, and I believe now it's up to 16 cities across the country. So we have some here on the West Coast, we have some in the Midwest, we have a lot in the South, and we have a few on the East Coast as well. So, and we're expanding. Every year we add new chapters, and so that's basically generally what BTAN is, if you're not familiar with it. And so our national meeting is basically an opportunity for our co-chairs for the BTAN chapters and some members who are currently in a chapter, and then other people who are located in a BTAN city but not necessarily members, to kind of meet and talk about the vision of BTAN, you know, what we accomplished this year thus far, and then what the plan is for the next year, and kind of develop that calendar, so to give you a little backdrop. And so the BTAN national meeting was attended by 49 people, so that's not including any BAI staff, so that definitely exceeded our expectations of who was going to show up. And of those 49, 15 of them were BTAN co-chairs, and so Linda was actually one of them there. And in terms of our evaluation, like this is just kind of an overview of the evaluation. I haven't actually computed the numbers yet, but in terms of the qualitative portions of the evaluation, people talked about, you know, what was most helpful, so networking with other people across the country from other BTAN chapters, figuring out what the national network was going to do in 2015, and kind of getting a better understanding of the BTAN vision, and learning about some of the best practices for some of our high-performing BTAN chapters. And then, so how can we improve the meeting? People wanted to hear from more chapters. So we did 2 best practices, which I'll talk about in a little bit, but people wanted to hear from other chapters and see what they were doing. They also wanted more interactions with other members. And so next year we'll try to incorporate those things. Want more national speakers. I think we had 3 or 4 national speakers at this one, and so people wanted to hear from, you know, other people other than the Black AIDS Institute staff, which is totally understandable. And then, of course, some logistical issues, a bigger room, and shorter presentations. And so that's just kind of the logistical things. So in terms of representation, like who was there, this is a room. You see Linda there to the left in the mint green shirt. So we had people from BTAN LA, Washington, D.C., Broward County, Florida, Melbourne, Florida, Oakland, California, Louisiana, Baltimore, Houston, and Little Rock. And then people who were not in BTAN chapters but were interested in starting BTAN chapters. We had folks from New York, Connecticut, and the Caribbean. I just give you a brief kind of overview of what some of those best practices were. So we did a BTAN Broward County, which is in Florida, and BTAN Melbourne are both in Florida. And I'm not going to read through each of these things, but as you can see, we kind of did a highlight of 2 of our high-performing BTAN chapters, and kind of what they do to make their BTAN run smoothly. So standing meetings, you know, establishing strong partnerships, all those kinds of things, kind of making our BTAN chapters, what makes their BTAN chapter more successful, or most successful as it can be. And it's going to vary from chapter to chapter, of course, because the local issues and the local needs are going to be different in each city. But this just gives you an idea of how people are making VTAM work in their city. And then finally, the VTAM project areas are here listed for you. And so we talked a lot about these at our VTAM meeting, and then Linda's going to talk to you a little bit about treatment education, so I won't go too much into that, but really just like understanding treatment, understanding the basics of HIV, and understanding how the treatment works to combat the disease. Patient navigation, moving people through the healthcare system. So kind of what Linda was actually just talking about is having those navigators to make sure that you're making it to doctor's appointments on time, making sure that you are making it, you're taking your medications as prescribed. And then disclosure and advocacy. Disclosure, I really want to encourage people to find safe spaces to disclose their HIV status, and a part of that is, it reduces HIV stigma when we know what the face of HIV looks like. And so if people can come out of the closet about their status, it makes it a lot easier for other folks who are newly diagnosed to say, I can get through this. And then also when we're thinking about criminalization, if you do voluntarily disclose your status, the idea is that, even though we're trying to change these laws, the laws as they are in place, you can't be criminalized if you have disclosed to your partner. And then again, advocacy, really trying to have an effect on the laws that affect HIV policy, healthcare policy, things like that. And again, changing those HIV criminalization laws. So these are 4 project areas for our BTAN chapters. And I'll shoot it back over to Linda to talk about the Brown Bag Lunch Program.
Okay, thank you, Rebecca. BTAN and BBL are a great combination. As we were going through the National BTAN meeting and the workshop, and then thinking about the work that we all do as Brown Bag leaders, I was looking at how the two could work closer together, and this is some of the information that I obtained to help piece it all together for myself. Combining the BBLs with BTAN monthly meetings, the topics that we discuss or present during our brown bag lunches, we should look at coinciding those with the 4 BTAN areas, the ones that Rebecca just covered: advocacy, disclosure, patient navigation, and treatment education. Say, for instance, under patient navigation, we have one of the topics were 4th generation testing. So coming to the BTAN meeting and the brown bag for the BTAN meeting that day, or training for the BTAN meeting, will be the 4th generation testing. Another idea or suggestion would be under disclosure. We had 2, if not 3 different brown bag topics about creating safe spaces. So I could see those topics coinciding with the 14 BTAN focus areas, and those are just examples. Also look at strengthen and sustain networks locally. Each BTAN chapter should have at least 50 members and 2 co-chairs. If you're not a member of a BTAN chapter currently, I encourage all of us to identify your local BTAN chapter, visit, find out information, and become a part of it. There are 4 different committees pertaining to BTAN, and at each committee are the 4 focus areas of BTAN. Once again, advocacy, patient navigation, treatment education, and disclosure, and there are chairs for each of those 4 committees. And we never know, one of us could end up being one of the chairs or even one of the co-chairs for BTAN. Also look at co-convening with health departments, CFARs, Planned Parenthood, and CBOs. And BTAN have monthly meetings and trainings. Excuse me. Another part of the great combination is increase and diversify co-convening organizations, develop relationships if they are not already developed, develop relationships and support from health departments, CFARs, Planned Parenthood, state ASOs, and others. Increase the number of seats at the table. some of those representatives from those organizations, as well as Department of Corrections, Department of Education, Mental Health Services, they may be able to not only just be a part of B10, but also have identified seats at the table of B10. And also, we're looking at promoting trained and effective Black leadership with key institutions. What are the key institutions that we're working with, and what are some of the key institutions we should start looking at working with? The next part is diversify and strengthen support for local B10 chapters. Excuse me. The biggest thing that stuck out for me is funding. What are some of the financial resources we could connect to for funding for B10 chapters? And I hope it's safe for me to say this, and support for brown bag lunches. We want to bring the two together even more, as well as identify funding and other resources that will support the hard work that we all do. And I found out in the National B10 meeting about the HRSA Health Literacy Project. I don't have much information. I'll mention the information I do have, but of course I'm going to refer, Rebecca is the super knowledgeable person about this. HRSA Health Literacy Project, trains 100 health literacy trainers that serve Black MSMs, that's men who have sex with men. And it's an opportunity to provide trainers with skills and tools to build capacity of HIV providers. So if the HRSA Health Literacy Project is something that you're interested in, Rebecca could be able to connect you to that resource. Next slide. Takeaways or next steps. Once again, when Cedric and I meet for co-chair for B10, when we meet, we're going to talk about merging the VBL topics with B10 meeting agenda. We started some this year, but we didn't get fully into it. So in starting 2015, we expect for it to be a full go. But the two of us will get together to strategically look at the VBL topics and where they should fit at what time during the B10 trainings and meetings, the three-day trainings and meetings. Partner with the state HIV planning group and care and services team. The same thing, getting them on board, uniform as B10 members, as well as B10 going in and provide brown bag lunches topics to them during their meetings. And that is some of the things that helped me accomplish the goal for brown bag this year. I actually presented some of the brown bags at the HIV planning group and the care and services group. Partner with historically Black colleges and universities and African American fraternities and sororities for PrEP and PEP. We're hearing the same way we're hearing about criminalization. We're hearing a lot about PrEP and PEP. And BBL and B10 are encouraged to get on board, learning about PrEP, learning about PEP, actually bringing in individuals that actually use this treatment and having them involved and being a part of the brown bag presentation, maybe as a panelist, and even a part as a B10 member. One thing that stuck out for me was create a B10 recruitment pack. Our goal is to increase the number of B10 members in all chapters, having a formalized recruitment pack, whether that's a brochure for B10, we have the actual application and other materials, taking that and building from that and securing a better recruitment pack so that we can all be on the same board or same ways with doing recruitment and how we recruit. Excuse me. One of the things we're looking at also, or a takeaway or a goal for us, is B10 having the lead on collaboration for National Awareness Day projects. When we were in the national meeting, we know World AIDS Day, National Testing Day in February, Women and Girls Day were identified as the top 3 and 4 National Awareness Days from the survey. So we would like to see B10, because B10 not only trains, B10 also have activities associated with the chapters. And we would like to see BTAN have the lead on those, bringing people to the table to have unified national service days across the state. The same day, several different places, or on some national service, national awareness days, same day, same place, all of us together. Another idea or item on the table is host brown bag lunches with elected and appointed officials and law enforcement. See if we can move into that direction. It's a kind of older concept. If they won't come to us, see if we can come to them to their meetings or to their sessions just for lunch to sit down and talk and educate. And why World AIDS Day, a big idea was or is to start looking at in that movement of getting local support is getting proclamations
Linda, we lost your sound.
Hello?
Yeah, we can hear you now.
Okay, you can hear me now. I'm sorry. Were you all able to hear the last part, getting proclamations from mayors, appointed and elected officials on World AIDS Day?
Now we did.
Okay, I'm sorry. my Bluetooth went dead. Okay. Excuse me. Change that.
Okay. Great. So now if you have any questions for Linda or for myself about criminalization, care coordination, patient navigation, the BTAN meeting, community mobilization, or the BTAN brown bag lunch combination, just let us know by typing in the question box on the panel to your right. And for the sake of time, as the questions are coming in, I'll go ahead and move to the announcements. So after this webinar ends, you will be prompted to take a survey. So if you could please complete that survey for us, that would be great. We have some upcoming AIDS 2014 updates. Minneapolis, Minnesota is next week on the 23rd. And then following, we have Birmingham, Alabama on the 27th. And then we have Houston, Texas on the 11th of November. We also wanted to let you all know that this year we will be sending out Brown Bag Lunch 2014 completion certificates. So for those of you who have completed, who at least attended 4 webinars and completed at least 4 community trainings based on the webinars, you will receive a Brown Bag Lunch certificate of completion in the mail. So I just wanted to let you know about that. And then we also have our final Brown Bag Lunch webinar coming up in November. This is November 19th, and it's a clinical trials update. And we're very, very, very excited about that. And so we'll have some representatives from the HIV Prevention Trials Network, Vaccine Trials Network, and as well as the Microbicide Trials Network talking about some updates for their networks. And then in a few weeks, we'll be sharing with you the 2015 Brown Bag Lunch schedule. And webinars next year will be monthly instead of 2 per quarter. They'll be once a month, just to let you all know. And I know you've all been hearing a lot about BTAN this webinar, and you're going to be hearing more and more about it because we're really kind of incorporating BTAN within all of our projects here at the Institute. So if you're not currently in a BTAN chapter, please look at these chapters on the screen right now. And so if you're in any of these cities, there's a BTAN in your city, and if the city has a star next to it, then we're coming soon to that city. So if you're in any of these cities, please let me know, and I will get you in contact with the co-chairs for that BTAN so that you can get involved in the trainings and other programs that are happening in that city. And if you're not in a BTAN city and you would like to start a BTAN in your city, again, please let me know. Next year we will be doing 3-day trainings in all of our BTN cities in the first quarter. And so if you're interested in starting a BTN, now would be the time to get the ball rolling so that we can include your city in those lists of 3-day BTN trainings next year. So that's it for me. We did get one question in from Julie. No, we got a couple questions in, actually. So Julie asked if we are going to share the regional resource, the National Regional Resource, I forget what it's called, Consultants Contact List. Yes, I do have that sheet. It kind of breaks down what the Regional Resource Network is, and it has the contact list information on the back. So I'll give you that. And I'll also send you the Train the Trainer webinar, Train the Trainer curriculum, and then I'll send the 15 ways HIV criminalization harms us all list. So you'll get those 3 things in a follow-up email from me. And so we did get another question that says, is there one place to go and see ongoing BTAN chapter activity? So can we see what the chapters are doing for World AIDS Day? So as of right now, no, but we're in the process of updating our website. And so for our BTAN section of the website, we will be having a list of kind of what the idea is that each of the chapters will kind of be put in a map. So you can be able to click on your state and you can see, you know, what's going on in those BTAN chapters in that state. And so, you know, if anybody is familiar with website technology, that you know, takes a while, but the idea is to have it up and running for 2015. And so for World AIDS Day, if you're interested in hearing about what each of the chapters are doing for World AIDS Day, just shoot me an email at RebeccaI@blackaids.org, and I will let you know what each city is doing, if they're doing anything, and I believe that most of them are. So just shoot me an email, and then I can send that information out to you. Great. So I think that was our last question. So if we have any other questions or comments or anything like that, please email myself or Linda about this particular presentation, and we'll be glad to answer your questions as best we can, and hope that you enjoy the rest of your week, and hope you have a great weekend.